Continuing coverage, the city of Rochester is set to hire a consultant to study Rochester's old state hospital, which was located next to Quarry Hill and on the grounds of the existing Federal Medical Center.
And KIMT News 3's Alec Lasham spoke with the History Center of Olmsted County today to discuss how Minnesota's second state hospital shaped the Med City.
Medical institutions have a long-standing history in the city of Rochester. The Med City is home to Mayo Clinic, which has been on the forefront of medical technology and research. However, it was the old Rochester State Hospital that used to reside on the Federal Medical Prison's grounds right here behind me that put the city on the healthcare map.
I think it was, for a long time, kind of a shining beacon of state-run hospitals here. That
was Krista Lewis, who is with the History Center of Olmsted County, talking about the lasting impact Minnesota's second state hospital had on the Med City. She says the hospital was built on 160 acres in 1879, predating St. Mary's Hospital by 10 years. It was originally intended to be a state inebriate asylum, but later became a state hospital after receiving more patients from St. Peter's facility, increasing patient size from 100 to 1,600 in the span of 5 years.
It was a major employer for a long time, and it tried to stay at the forefront of medical activities, so it was very much at the leading edge of medical treatment.
Treatment that ranged from occupational health practices to other outdated methods.
Shock therapy would have been one, and as I said, kind of occupational therapies, getting people to be active and busy, and so they're not just sitting around in a room, and to give them a use with their daily life.
In addition to treating patients, the medical institution also had one of the nation's earliest healthcare career programs.
The state hospital had one of the very early nursing programs in the country, and of course, nurses would have been needed for Mayo Clinic, so I'm sure plenty of nurses got their start at the state hospital training school before moving on.
It says the hospital continued to grow for the next 100 years before shutting its doors in the early 1980s.
The reason given at the time was financial, that there wasn't really money to support it anymore, and they were moving from around the late 70s, there was kind of a movement away from state institutions to community-based facilities.
In 2023, the city of Rochester is looking to learn more about the old hospital. Molly Patterson Lundgren, who is with the city's community development department, says it's important to understand how mental health care has changed, as well as the lives of those who call the hospital home.
We continue to address different ways to deal with mental health issues within our communities, within our culture, and just to have a better understanding of how that's changed over time. Did Rochester play a larger role as a medical community and as part of the state hospital system? And again, to get a better understanding of the lives of the people who were associated with the hospital, either who worked there or lived there.
In Rochester, Alec Lasham, KIMT News 3.
Interesting. And Jennifer Holland, who is with the Federal Bureau of Prisons, says the Olmsted County Board of Commissioners purchased the property for, get this, $1 back in 1982 and then sold 64 acres to the BOP for $14 million in 1984.
Incredible. Patterson Lundgren says the city's study should be completed by late fall.